Hi, and welcome to How to Beat Nick, episode 14, where we're going to talk about 3 unique arguments that will help you win healthcare debates in ways that a lot of debaters really don't think about. So, the first argument we're going to talk about is nurses. Nurses operate within the healthcare layer of the debate. So if you remember, there's health, healthcare, and health insurance. Nurses operate within the middle layer, which is healthcare. The supermajority of healthcare cannot be effectively provided without nurses. This is because while doctors can diagnose and surgeons can operate, nurses do shit like keep your bed sheets clean and prevent infections in your open wounds and make sure that you take your medicines at the appropriate times so that they have the effect that the doctors want them to have. Without nurses, doctors can figure out what's wrong with you and they can prescribe pharmacological regimens, but you will not be taking the drugs at the required frequency or at the required times, so you will not be receiving your pharmacological regimens. Surgeons can cut you up and operate, but when they bandage you up and nobody changes your gauze for 3 days, you will fucking die of blood poisoning. And I just think far more saliently, like the vast majority of patients, the sick, the elderly, the incontinent, and children, literally can't take care of themselves. Especially if you've like 103-degree fever and you can't, clean up your own urine, you will get yourself sick and die in the absence of nurses. The problem is, nurses are incredibly underpaid, and there aren't that many nurses in society, and there are certainly far too few nurses relative to the healthcare system's need for nurses. While it is true that we are experiencing a minor shortage of doctors, that shortage is actually solved for by net immigration because we tend to let in people with advanced medical degrees through the H-1B system. Nurses don't have advanced degrees and so aren't eligible for immigration. Plus, we just kind of need a lot more nurses than we need doctors, right? Like the ratio of doctor to nurse is such that a nurse shortage is far more acute and far more exacerbatory. Nurse shortages arise in the places you would expect them to arise, places without money to pay them, and places that overwork their existing nurses. To some extent, you can supplement your nurses with your first year residents and your medical interns, but one, they don't do as good a job. They just kind of make mistakes because they're focused on studying for their classes or their own doctor speciality. They're not focused on the best way to insert an IV or the best way to clean someone's fucking bedpan. And second, it's just like a short-term solution. Those people churn. They're just not as good as an experienced nurse with 20 years of experience on the job. If you can implicate a debate to the nurse shortage, the weighing is really simple. This is actually just the bottleneck to providing effective care. Hospitals are turning away people or they're providing really subpar care because they can't take care of the basics. They can't ensure patients get food and water and medicine and clean sheets because they don't have adequate nurses on their staff. Not just to do the kind of upfront care of patients, but to manage the paperwork to ensure that the patients get their medicine, get their food on time, to do that final line of distribution between the hospital kitchen or the hospital laundry and the meals that are eaten and the fresh sheets that go on people's beds. So if you can implicate your argument to the nurse shortage, you can probably just win the round in terms of patient care. The second, I think, really critical argument is doctor strike/refusal. So doctor strike/refusal tends to operate on the question of malpractice insurance. If you are a doctor and you operate without malpractice insurance, you are stupid and won't be a doctor for very long. America has just gotten incredibly litigious with respect to doctors because people in medical debt really have nothing to lose and they have everything to gain if they manage to get a settlement from the doctor's malpractice insurance. So if anything goes marginally wrong, whether or not that's potentially the doctor's fault or not, doctors get sued. Juries are also incredibly sympathetic to these suits because they see doctors as quite rich, and they see their patients usually as quite poor. So they tend to be a little Robin Hood-y in the way they perceive the interaction between doctors and patients. Malpractice insurance does 3 things. 1, it ensures doctors can keep practicing medicine. 2, they are just a much better adjudicator of whether someone fucked up than a jury. Juries are 12 idiots. Malpractice insurance people actually have a good understanding of the financial costs of whether or not a doctor's a financial liability or a financial benefit. So they just make better, more educated decisions. I get we care about the democratization of the criminal justice process and whatever. That's why we have juries. But I actually just care about the expertise of my doctor and would really rather the adjudication of whether or not someone deserves to be a doctor remain in the hands of medical bar associations and malpractice insurance companies. So if a doctor thinks what they're going to do is going to avoid the malpractice premium, it's going to get their license stripped. They just won't do it. It's their career. They went into hundreds of thousands of dollars in medical debt, worked through 2 years of residency, finally paid off their medical debt, and are just now making bank. Actually throwing away their life is just like a little nonsense, and nobody would be willing to do it. So anything that could trigger lawsuits, anything that could trigger state investigations, these things are just really, really, really bad for doctors. They will refuse to do them, or they will suffer the consequences of lawsuits and or the state stripping their license because they did something that the state didn't want them to do, or that their malpractice insurance company didn't want them to do. The third and final argument that I think is really useful in a lot of healthcare debates is health insurance works generally as a risk pooling system, right? It's just like, oh, so that you don't pay millions of dollars when you get sick, everyone pays a little, and then we'll pool together that risk and cover your costs. The problem is insurance companies make obscene profits because while they are a highly regulated industry, the regulatory body and the laws are incredibly corrupt. There's just too much lobbying, et cetera, et cetera. So insurance companies end up taking a huge amount of profit out of the middle when it comes to effective price of healthcare. What this means is everyone is overpaying for healthcare across the board. But what it also means is that the healthcare layer of this debate, the doctors and the nurses, are getting way less money than they deserve. So if there's an argument that ends up taking money out of the pocket of health insurance companies, sometimes that money will go back to consumers in the form of lower insurance costs. But far more often, actually, when you think about the mechanisms of any given round, that money will go to the healthcare providers. It'll go to hospitals. It'll go to doctors. It'll go to nurses. And if it does that, you tend to get better health outcomes for society because all of these people are actually quite underpaid.